Welcome to the life cycle of the patient. This video will go over the basic overview of how a patient comes into the practice, how they're treated, how their treatment planned, and how they are scheduled in. Now, this is specifically made for Clear.Dental. However, very little in this video is specific to Clear.Dental itself, so feel free to use this outside of the Clear.Dental context. So, let's start at the very beginning, which is when the patient fills out the new patient form. Now, technically, yes, you can still add in a patient to the schedule without them filling out the new patient form. That would be a blocker. But in general, we don't like to put in blockers into the schedule because you don't know which actual patient will be calling, which patient you want to confirm. You want them to fill out the new patient form as soon as possible. That way, one, you know what they're looking to get done, and two, you can do things like insurance verification before they actually come in. So we will have a separate video for the new patient form, but for now, let's assume the patient actually fills it out. Part of the new patient form is actually saying, are you in pain or not? So if they're in pain, they are not looking to get a comprehensive exam. They're looking to get out of pain. That's what the limited exam is all about. You look at one particular tooth and you fix whatever needs to be done for that particular tooth. A common example is a tooth is broken, patient either wants it extracted or fixed. So in this particular route, the pain route, the patient will come in, have a limited exam, will get extraction, filling. Also, they'll be getting some x-rays before that is actually done. Now, after the limited exam and the procedure is done, normally we actually want them to come back. Why? Well, there could be other things happening in the mouth. So we normally would tell the patient, hey, to prevent something like this from happening again, why don't you come in and we'll look at all your teeth? And that's what the comprehensive exam is all about. So if the patient is not in pain, they go straight to that comprehensive exam. And we would ask them, okay, what are you looking to get done? Do you like the way that your teeth look? What is your oral habits? Like, do you floss every day? Do you brush every day? You get a lot more things and you get a better answers from the patient when they're actually coming in for the comprehensive exam. Now, this is where some doctors will actually disagree with me, which is perfectly fine, but just for the sake of this flowchart, I wrote down if there's lots of issues, we do a full mouth series. That's its own decode. So you'll see some decodes here. That's a US standard thing, specifically the American Dental Association standard. They start with a D and then a 4-digit number to indicate the procedure. So a D0140 is for a limited exam. A comprehensive exam is a D0150. A full mouth series, often abbreviated FMX, is a D0210. If they don't seem to have that many issues, then we would do 4 bite wings and 2 periapicals. You don't need to know too much of the details of what that means. Just know that the x-rays tend to be based on the situation with the patient. So it's a patient by patient thing, and it has its own billing codes. With Clear.Dental, it will automatically know what radiographs were taken and will automatically figure out which codes needs to be billed out, and then we'll automatically submit those codes at the end of the appointment. So this is normally one single visit, the D0150, the full mouth series, or the bite wings. Also part of the first visit would normally be the cleaning. At least that's what patients tend to expect. It doesn't have to be, and actually it probably wouldn't be a good idea if they need something more than a regular cleaning. Now, Internally, Clear.Dental likes to use the term prophy. It is a very slang term. The proper term is adult prophylaxis. But the D code for that is still the same, D1110. And most people associate that with a regular cleaning. There's another type of cleaning called scaling and root planing. It's very similar to a cleaning, except you go below the gum line. Now, you see this area here called phase 1, 2, 3, 4. That is just the way that I like to phase treatment. The whole idea of phasing treatment is then you are able to tell the patient, we are going to do XYZ first, and then these other procedures afterwards. So the patient has an idea, okay, next visit is going to be this. The visit after that, we're going to do this. And then we're going to get to this tooth after we get all these other things done, because that's a very common question patients have. Oh, when are we going to fix this front tooth? We'll have to say, yes, first we have to make sure your gums are pretty good. But don't worry too much about the actual order. It's more up to the doctor what order these procedures are done. So these phases 1, 2, 3, 4 is based on the auto phase feature that's built into Clear.Dental. So if you have a bunch of different procedures that's in the patient's treatment plan, hitting the auto phase would automatically separate it out like this. Now, Clear.Dental supports N number of phases. So yes, technically you could have 99 phases, but that's probably never going to happen. In this particular way it's set up, phase 1 is everything for preventative or for making the gums nice and healthy. Phase 2 is whatever fillings, including composites and amalgams. Phase 3 is everything that's prosthodontics, including crowns, bridges, implants, and dentures. And then phase 4 is more preventive measures like either a night guard or periodontal maintenance. So the idea is that you work from phase 1, get all of that done. You do phase 2 work, get all of that done. Certain things that could be in phase 1 or phase 2 can be moved around. That's why we have a separate module for treatment planning. There are certain things that are also unphased. The most common thing would be the recare phase. It's its own phase in itself and doesn't really belong to a 1, 2, 3, or 4, but I'm getting a little ahead of myself. So by default, you want to complete everything in phase 1, everything in phase 2, then everything in phase 3, then everything in phase 4. There could be situations where there's only phase 1 and then that's it. It's a patient-to-patient kind of thing. After you're done with all that is the recare phase. Now with recare, there's a separate D code because when you do a comprehensive exam, you're doing all the charting for the first time, and that can take a little bit longer time compared to the periodic exam, in which you just are looking for changes since the last 6 months. Normally, you want to do all 3 things in a single visit. The whatever x-rays are required, the periodic exam, and the cleaning. So in a perfectly healthy mouth that has nothing going on, they would just come back for another 6 months. Now, the other thing about the 6 months is that that's more of a insurance thing rather than a evidence-based requirement. It's certain patients may need to come in every 4 months. Some patients need to come in every 3 months. Some patients don't need to come in until 12 months. It's a patient-to-patient thing, and that's why when you complete the prophy, you'll actually ask the hygienist or doctor, when is the patient coming back? In 3 months, 6 months, 12 months? And it would automatically be sent over to the front desk to say, okay, in this many months, please schedule the patient for the next recare which would be the periodic exam, the cleaning, and if they are due for any kind of x-rays. Now, this is if there are no problems. They just keep on looping back and forth, back and back and back. And that would be more or less in a perfect world, but we don't live in a perfect world. Every now and then there's a cavity. So if you see a problem, then you treatment plan that, and they would basically go back to the kind of phases. Now, normally when they go from a recare phase, it's normally nothing too big, either a single filling or a single crown, but every now and then they could have a lot of work done, but you still work the same way, starting from phase 1, phase 2, phase 3, then phase 4, and then they're back to the recare. And we just want to keep patients here as long as possible. And that is the general overview of the life cycle of the patient. There will be separate videos for each of the modules because there is a module for almost everything you see as a rectangle here. So don't worry about the fact that I have glossed over every procedure that's out there, but this video is a brief overview of everything that is done with the patient.